Meanwhile, Mizoram government has framed guidelines to place asymptomatic patients under home isolations in a bid to ease shortage of hospitals to treat COVID-19 positive patients in the state. As majority of the COVID patients in Mizoram shows no symptoms for the virus, Mizoram has only one dedicated COVID-19 hospital, Zoram Medical College, where symptomatic COVID-19 patients and those with comorbid conditions are being treated. Here's a report. All asymptomatic COVID-19 patients in Mizoram are likely to place themselves under home isolation soon. As most of the COVID-19 patients in Mizoram showing no symptoms for the virus, the state government has framed guidelines to place asymptomatic patients under home isolation in a bid to ease a shortage of hospitals to treat COVID-19 positive patients, a health department official said. The decision came in the wake of the surge in COVID-19 cases to ease the shortage of COVID care centers, as the state has only one dedicated COVID-19 hospital, that is Zoram Medical College. According to a health department source, a meeting chaired by Health Minister Dr. R. Lalthangliana on Tuesday, 15 September, reviewed the home isolation guidelines and referred it to the Chief Minister Zoram Thanga for approval, the official said. He said that the order allowing home isolation to asymptomatic positive patients would be notified when the Chief Minister approves it. The meeting also decided that any COVID-19 patients who are declared asymptomatic by registered doctors or medical practitioners will be allowed to stay in the home isolation depending on their health condition. However, a symptomatic positive patient will be allowed for home isolation after proper evaluation by the health department and on fulfilling of certain conditions, that they have isolated rooms, a separate bathroom, and that they have been permitted by village or local level task force of their village or locality. The official also said that a caregiver should be available to provide care on 24/7 basis, and the patients will be monitored by the health department. Earlier in July, the Union Health Ministry has already allowed home isolation to asymptomatic positive patients. The Mizoram government is making massive effort to set up more COVID-19 care centers to treat COVID-19 positive patients, as it is bound to face a shortage if the number of COVID-19 patients keeps increasing at a higher rate. The government has so far set up 35 COVID-19 care centers to treat asymptomatic patients. Mizoram has only one dedicated COVID-19 hospital, Zoram Medical College, where symptomatic COVID-19 patients and those with comorbid conditions are being treated. Mizoram on Wednesday morning reported 1,480 coronavirus cases, with 558 active cases, 955 cured, and no fatalities so far in the state. Bureau Report.